Well, I think it's about 11 and we have a bunch of people here. So we're going to go ahead and officially get started. So, okay. So now I think everybody sees me and we're going to see Kate soon. Kate is going to be joining. She is here. She's listening. She's going to be joining us soon. So I was taking a look at everyone who's here. We have some people who've been to the other ones and some new people. So welcome back or welcome for the first time. Glad that you guys are here. Important topics today that we're going to talk about, of course. And yeah, I see a couple names I don't recognize and a lot of people that I do. So I was just saying, for those of you who didn't hear, how much I miss the trainings that we do in person. And I really miss seeing your faces and just hearing your stories. I mean, I have good stories, but I know all my stories. I like to hear your stories sometimes. So let's get started. Today we're going to be talking about I Drink Alone. We're going to be talking about drug and alcohol issues, which is important because even though we're in a pandemic, we still have an opioid epidemic going on, and that's actually expanded now into what's called an opioid and stimulant epidemic. That's just how the transition is happening. So we're going to talk about those things. We're also going to talk today about just us earth people. That's what they call us in the rooms. People who do not have a substance use disorder. But people in the pandemic who currently are maybe drinking a little more or imbibing in some other things a little more than they might typically do. So we'll talk about those things. But first, I want to thank Beaver County Behavioral Health, who has sponsored us and allows us the technology and the time and the energy to make sure that we can put this on. Our whole purpose is to really just give everybody a little bit of a break to kind of get out of yourself and focus on important topics, but also just laugh and relax a little bit. I think that's important. I want to do a shout out, of course, to Jen and to Kim from ETC. They are definitely my right and my left hand, and I'm so grateful for them. They help with the technology. They help with getting things together. They make sure nothing is unusual or odd, and they give us a little critique when we need it so we can always make things better. So thanks, guys. They're behind the scenes. You guys never get to see them, but they really do the work to make this happen. Today, Kate Lowery is joining us, and then we have one more session scheduled. That's next Friday, May the 15th. That is called Dancing with Myself, Billy Idol song. And Marie Timpano, she is the executive director of the Cornerstone of Beaver County, is going to be joining us. So we're going to talk about things like home life, homelessness, which is still continuing here in the pandemic, and maybe even increasing some. And we're going to talk about the healing power of music because Marie is a musician. So that'll be some good information. So I want to thank backwards. I want to look backwards and just say thanks to Steve Cooley, thanks to Jack Manning, who have been our two co-hosts in the past. Thanks to Kate, who's here today. And we're reminded everyone that this is Mental Health Awareness Week. And so I saw the green lights in Beaver the other day in front of one of the buildings, and green's the color for the week. Today's the last day of the official week, but mental health awareness, particularly in our current times, is always really important. So glad you guys are here. And at this point, I'm going to introduce our guest host. So Kate, you can go and turn your camera on. This is Kate Lowery, who most of you probably know. She is the Single County Authority. There she is. Hi, Kate.
Hi, and hi, peeps.
Hi, peeps.
I miss my peeps.
Kate is the Single County Authority for Beaver County. She handles the majority of the funding for drug and alcohol programs. She is kind of my partner in crime, so to speak, when I kind of follow her around and we do some drug and alcohol and Narcan trainings together. We even have pet names for each other. And so, Kate, thanks for coming. I'm so glad to have you here.
Thank you.
Loosen everybody up. Kate and I have a long history together, but a funny story. I think this was about a year, maybe 2 years ago. Kate had an appointment at an eye doctor. Do you remember that?
I certainly do.
In Beaver. And so she was going to have something done with her eyes where she wasn't going to be able to drive. And she asked me if I would take her and drop her off at the appointment, and her husband was going to pick her up. So I take her to the eye doctor, and I pull into a parking spot, and she is standing outside of my car with the door open talking to me before she goes into her appointment. And these two ladies start to walk behind the car, And the one lady said, "Excuse me, we're back here." You know, I guess she wanted to make sure we knew that they were there, so I didn't back up. And Kate said, "Oh, okay." And then Kate, to be funny, said, "Floor it, Jill." And then when we looked, we realized that one of those ladies was blind.
Not a proud moment.
Not our best moment, right, Kate?
Right, right. It was funny only to us.
Only to us, and maybe to some. Oh, look, Bonnie says she misses you, Kate. That's so
let me figure out how to answer these chat things. I miss you too. I miss everybody.
Now, the other part, because that story didn't end there. The other part of that story was I left Kate at her appointment and I was going on to a meeting, and I got literally maybe 4 blocks down the street, and Kate called, and I thought, well, that's weird. So I answered and I said, "Hello." And she said, "Can you come back and pick me up?" And I said, "Well, what about your appointment?" And she said, "My appointment was last year." So tell them how you did that, Kate.
Well, I was so proud of myself because I have this messy little wallet, and I just always shove all of my stuff in this wallet, including appointment cards. And I found this card when I was cleaning out my wallet, and I thought, great, I'm going to get this appointment up on the calendar so I'll know when it's coming. I missed the appointment, and I was really proud because I was so organized. So I had it on my calendar, lined up my transportation, took half a day off of work. And here it was the old appointment that I had never made. So behind that, further down in my messy wallet was the current one, which was a couple months later. And Jill, again, took me to that one. And that time it was full and people were there because it was an empty parking lot that day too.
It was, except the 2 blind ladies, yes.
Yeah, yeah.
Oh gosh. Okay. One more quick thing before we get into talk about serious topics. I see that Jennifer from the Beaver County Jail, Jennifer Monza, has joined us, and I realized the last session that was Jennifer's birthday, and she was here with us, and I didn't say happy birthday. So we'll take this time to, so everybody, if you want to message Jennifer and tell her happy belated birthday, I'm sure she would appreciate that. So Kate, let's just start a little bit. You do a great job of doing like a state of the union of what's going on in the county when it comes to drug and alcohol. Can you give us just a brief overview of what's happening in Beaver County right now with drug and alcohol trends and services during the pandemic?
Absolutely, and thank you for your kind comments. As a matter of fact, just yesterday, we went live on the Overdose Free PA website, which is developed by the University of Pittsburgh School of Pharmacy Education and Research Unit, known as PIT Peru. That is a public website that is open for anybody to view all kinds of really pertinent information about overdose prevention, and including the county data on overdose death for every county in the Commonwealth of Pennsylvania. So as of yesterday, Beaver County's first quarter data went live on the website. And for the months January, February, and March, we have lost 16 lives to accidental overdose. Every life is important. Every death is important. What I will say is, for the first quarter, if we take a look back, for first quarter, we really haven't seen a huge increase. We're pretty much status quo, and potentially we might even be a little bit lower. I'm not certain. I did not compare to last year, but we did not see a spike the first 3 months. We haven't looked at April yet, but we're working very closely, the coroner's office and myself, and he recognizes and acknowledges that even in the midst of COVID, he is very committed to trying to be as close to real time as we can in our responsibility to report to our Beaver County residents where we are. What I will tell you that is a concern to me, and Jill, we do our trainings. I haven't even had a chance to share this with you yet. Mm-hmm. In those toxicology reports, most of the drug overdose deaths are combined, as they always are. Most of them are combined. It's rare that there's one single agent in the system of the decedent at the time of death. Most of them, as we would expect, have fentanyl in them, but a lot of those deaths were also attributed to heroin, which we had not seen a lot of heroin last year. We would see some, but many of those 16 deaths it was heroin in addition to fentanyl. So heroin is back out on the street. I don't know what that means at this point, if people assume, or if it has to do with accessibility, I'm not sure. And again, heroin is dangerous too. So I don't know, what that all means, but that's where we are at the moment.
That was weird. Did you hear that?
I did. And Jen's name flashed across the screen for a minute.
I think that some of it is anecdotal from clients that I've talked to that have addiction issues, substance abuse disorders. In the midst of the pandemic, they have a lot of fear about other things in addition to what they usually have fear of, just like the rest of us. And some of them have said to me that they are making decisions to try to be safer. And in some ways, in a distorted, disordered substance use disorder mind, heroin is safer than fentanyl. And actually, there might be a tiny bit of truth to that, I suppose. What I always remind them is it's not safe. Even if it is safer, it is not safe, if that's even true. And that fentanyl issue, you still don't know what you're getting when you're dealing with that culture. Who knows what you're getting.
Right.
So,
it's still, the streets are unsafe, no matter what.
The streets are unsafe, yes.
The streets are not safe.
So it'll be interesting to see how that plays out, Kate. Like how, because we were seeing a decline overall in our overdose deaths in Beaver County, spikes, but overall. So it'll be, hopefully that trend continues. Hopefully what's happening in the world does not give that something different.
Correct. And another thing I'd like to emphasize, what we've seen in our office, and I will talk about the availability of services too, for questions. We have seen, alcohol was, and always will remain a problem as well. And I never want to lose sight of that. And people with alcohol use disorder suffer just as much as people with opioid disorder, and their families do too. The effects of alcohol may take much longer to have fatal outcomes, but alcohol can be potentially fatal too. And with that, we have seen in our office, I would say probably over the past at least 6 months and maybe longer, a lot of people seeking services who are alcohol dependent and having very serious medical complications from that as well. So during this pandemic, another part of our job is to manage the network of care, the system of care, to make sure that we have bed availability. We're really keeping an eye on the need for those hospital-based programs for people who might have medical complications due to alcohol use disorder. So we are working closely with the University of Pittsburgh Medical Center and Dr. Michael Lynch. It's a telehealth bridge program where if people are in need, maybe not of hospitalization for withdrawal, but they are in need of urgent withdrawal management for alcohol or opioids. Through our office, we can put them in touch with Dr. Lynch's crew, who can, they'll have a physician that will do a brief screening. They can prescribe some comfort medication for the person until we can then bridge the person to a level of substance use treatment that they need. So we are really working hard, especially in the middle of a pandemic, to make sure that those highest risk populations are still getting the emergent and urgent needs taken care of, and that they're still on our radar screen to get them the care they need.
Tell us, Kate, what is happening with beds in the area? Let's talk about inpatient first. So detox, non-hospital based detox, inpatient programs. What's happening with those providers in the area and that the county is covering?
We are very fortunate in the county at the moment, because this is always a rapidly changing
Right.
situation, but we are very fortunate that at the moment, bed availability has not been a problem. We maintain daily contact with our providers, and there have been some providers throughout our whole system, our whole network, that from time to time will report to us that they've reduced some beds in order to prepare for COVID quarantine. If there are patients or staff who are testing positive, we're getting notifications from those providers that temporarily they're suspending admissions. But luckily, we have many contracts, not just here in Beaver County, but in the region and across the state. So we have been able to place people. And interestingly, and we're still doing a fair number of assessments. Our assessments, I think in March, actually had picked up. And we had a pretty robust April as well. But we are seeing that a lot of people are not necessarily wanting to go into the residential levels of care, probably for fear,
Sure.
but I have to hand it to the providers. They're doing as good of a job as they can with limited resources because of the vast, widespread pandemic. And the communication has been very good. Working remotely does not mean working less. I cannot begin to say enough about our case management unit. They hit the ground running, day one when we went remote, and they are working so hard and harder, trying to do all of this from home and maintain contact with our clients, and then follow all of the regulations too. So I can't say enough about how proud and grateful I am to our case management unit for everything they're doing pretty much round the clock.
I've had 2 clients recently that I wanted to go to inpatient, and it was easy to find them beds. I was really impressed with the process of utilizing telehealth, but also very open and direct with communication. Like, here's what's going to happen next. Here's what's going to happen when you come here. Here's the precautions we're taking. Now, both of those clients declined to go. And I think there is fear about being in a hospital type place, around a bunch of people that you don't know. But I think also, and this is something that we have to remember, is, there's always people with substance use disorder always looks for the easiest, softest way. So if I can say, oh, I can't go to inpatient because there's a pandemic, then the brain kind of says, yeah, that's totally rational. That's rational. So I think, and that's what I saw in these 2 particular clients, was it really allowed them to go a softer, easier way, or what they think will be a softer, easier way. Mm-hmm. Now, talk to us a little bit about what's happening in the outpatient world.
The outpatient providers are doing their best to convert to telehealth. And again, we maintain close contact with them, trying to help them, give them some technical assistance. But, that we're still referring a lot of people to outpatient. Medication assisted treatment too, that is, and I want to also give an update that effective in July, with our new contract agreement period with the Department of Drug and Alcohol Programs, we will be required to provide access to all levels of medication-assisted treatment. So buprenorphine, Vivitrol, and methadone, we will be required, as will the providers. Now, that does not mean that a provider will be required to dispense it, but the state and the governor have really made it their mission to expand the accessibility of medication-assisted treatment to all individuals who are, as an option, as a bigger part of the continuum of care. So there has been an increase in authorized services through our office in recent weeks for methadone. And, we're working closely, and, it's also a little bit of a challenge coming to the end of a fiscal year. Our funds are not, infinite. But so we're working very closely with our fiscal department too, to manage those funds as best we can. But we are seeing a bit of an increase in demand for medication assisted treatment as well.
Well, and I was on, I gotten some information recently, and you're aware of all this, I'm sure, but they have loosened up a lot of the regulations, particularly around MAT. So doctors are allowed to give longer prescriptions. They're allowed to do, they don't necessarily have to have a face-to-face before they prescribe. So some of those things, based on what's happening in the world right now, to still allow people to get their medication and get treatment is important. And we've seen that in the behavioral health in my world too, where we're able to do telehealth without a consent being signed, because that's difficult. Sometimes we're not seeing the person. Not everybody has the ability to print a consent, sign it, and scan it back to us. So those types of things. And even therapists doing telehealth sessions on non-HIPAA compliant platforms, which I'm proud to say we are not. in my practice, we have a HIPAA compliant platform, but some therapists, but those are expensive. And so I think that's a good thing that they've lifted temporarily. My concern is what happens when the rules go back into place. It's hard, it's like that slippery slope. Like we've kind of like thrown our hands up in the air, and at some point we're going to have to sit back nicely and follow the rules again.
Right. It's going to be hard to unring some of these bells.
Yes.
Sure. And one thing that the department did tell us yesterday on a call, because there's been a lot of talk, especially among the provider network, is for the verbal authorizations that we are granting through telehealth, because obviously we cannot get the client to sign. We're not doing face-to-face. In the drug and alcohol world, we will not be required to retroactively go back and obtain
nice
written consent.
Okay.
That is something from an administrative standpoint, because again, preceding us going live with this webinar, we were talking about, there will probably be a tremendous impact on all of us as far as the demand for services when this all opens back up. And so that's one thing I was very happy to hear. That, unless we hear otherwise from SAMHSA, so far there's been no indication in the drug and alcohol world that they will require our clinicians and case managers to go back. So that's good.
One of the things we do here in our practice, for every telehealth session, there's a checklist that the therapist has to fill out. And it includes identifying the client and the address of where they are during the telehealth session, in case there would be an emergency, and someone who they can contact that's close to them for that session if there was an emergency. So we have all these forms, and the secretary, of course, she's working from home too. We forward all the calls to her, and she takes care of all that from home. So there is a stack like this big of forms. And when she comes back, she's like, "Can't I just come in for a little bit now and get some of that done?" And I probably should let her, because it's really piling up.
Keeping her up at night, Jill, I'm sure.
All those forms. So a couple of things I just wanted to mention about people who currently have substance use disorders and who are in early or in recovery. Some of the things that's important for them to do would be to keep going to their meetings. And most meetings have moved to a virtual platform. I know one of my patients tells me about a meeting that he goes to in Hopewell where they're still meeting live and in person. And the church where they meet at, and I don't know which church, so I apologize, but the church that they are meeting at has provided them several different rooms. So they can be in very small groups and, having the same meeting going on, but in a lot of different areas. And he said the one gentleman I spoke to said they've really seen an increase of people coming there. People were doing virtual meetings and are doing virtual meetings, or maybe weren't going to meetings, but really started to feel like I need to get to a meeting. So we encourage people, if you're in recovery, keep getting to your meetings, do what you have to do to make that happen virtually, even though it's not perfect, get there anyway. increase maybe talking with your sponsor and whoever your other supports are in your we. And really, you know, we always tell people, think the tape through. You know, if you're feeling stress, you know, the difficulty with stress, and I had a study here that I wanted to talk about real quick. Talked about, well, it's too much because we have so much to talk about, but basically it talks about the brain changes when there's substance use disorder, and it makes the brain tolerate stress less efficiently. And so that doesn't just go away when people get into recovery. It does eventually get better, and people do learn new skills, but it's physical changes in the neuroadaptations of the brain. And so we have people going through this pandemic like you and I, Kate, who have everyday stressors of life, which can be very stressful. But then we have people who are also have this extra level of stress from dealing with brain changes based on substance use disorder. And that stress that you and I are experiencing can be twice as difficult for them. And the consequences could be much more dangerous too. So anyone that's out there, and I know you guys take this to heart, you know, if someone is reaching out to you, or if someone's on your mind, someone who's in recovery, you know, just reach out to them. That means so much, just to have a little connection, and you never know when that might make a big difference for someone. But Kate, the other thing I wanted to talk about a little bit today was how alcohol use and other drug use, particularly marijuana, is increasing amongst the regular population. So we're not talking substance use disorder folks. We're not talking people who need to or have been to treatment. We're just talking about people who are at home all the time. And I was talking to a principal recently who said to me, I know that some of my teachers are drinking while they're doing their virtual work at home. And he wasn't complaining. They're not doing anything crazy. But this is part of the lifestyle of what's happening, is that there's a lot more use of alcohol, and particularly marijuana. So what do you think about that, Kate?
I think at the end of the day, it all comes down to self-care. You know, for me, my trigger is food. I'm a card-carrying lifetime member of Weight Watchers, and I've gained and lost the same 35 pounds at least 3 times in my life. And one of my best leaders ever likened slips, or relapse, so to speak, to you're heading down a flight of stairs and you trip. So
Okay.
grab onto the banister and set yourself straight and proceed down the steps, or do you say to heck with it and fling yourself down? And so I do think, responsible use of alcohol is fine. Any use of marijuana except with a card is illegal. So,
Right.
So I think for people who are making choices, those types of choices through food, through alcohol, to
Video games,
don't get me started on that.
social media, yes.
They should be outlawed. I think it's about, balancing that with other habits too that are going to promote self-care. So, maybe before you get to the point where you're slipping by having, one drink turns to 5, turns to daily, turns to weekly, and, your pattern of use, even if you haven't had an issue in the past, is increasing. Let's dial that back and grab onto that banister and say, what other changes can I be making in my environment so that maybe I still can have responsible, I can drink responsibly, or I can eat something extra that like my comfort food, but can I also build into my schedule other things, maybe take advantage of this time at home to kind of just balance that with other things that are going to promote health and wellness.
Right. Well, and this is a really good time to do that. So I like that analogy. I would encourage everyone who's here listening with us today to grab onto the banister today with whatever the issue is. I was just saying to some of the ladies this morning before we officially started, when I heard last night that our stay at home has been extended through the beginning of June, from our governor. Did you hear that, Kate?
I did hear that. I didn't know that.
You looked like, I was like, oh my gosh, did Kate not know that?
Yeah, I didn't realize it was specific to Beaver County.
It was. Beaver County is going to stay a red area until a red county until, at least that's what they're saying now, at least until June the 6th. So when I heard that last night, I said to myself, I have got to take a look at my routines, because what's happened is I'm working every single day. Now I'm not working big, long, full days like I used to, but before I had a weekend, and now I don't have a weekend because I just work on Saturday and Sunday too. You know, it's like another day. So I would encourage everyone to grab a hold of the banister now, knowing that we're in for a little bit longer, and take a look at that. Now, the good news is, from studies that they've done from SAMHSA, they say that during disasters, now we don't have specific information about pandemics because we've never experienced that before, but as far as disasters are concerned, which is what we'd kind of look at what this is, significant crisis in our country, there usually are not many new cases of substance use disorder. So that's the good news. Even though alcohol use and other drug use does increase, particularly alcohol, marijuana does increase during those crisis times, it usually for most people returns back to normal. Now there's a couple things to red flags we should look for, and a couple populations that are a little more risky that we want to be careful of. But so here's some things from the post-traumatic stress disorder department of the VA to help you manage alcohol, medication, and drug use. So these are tips for all of us. And you kind of touched on some of these already, Kate, but one is to really pay attention to any change in your use. You know, just notice, just be a little more mindful that I used to drink once a week and have a glass of wine, and now I have a glass of wine every night. And just be mindful of that, because in these epidemics, these pandemics, I guess, in this lifestyle change, we kind of get on autopilot. May not notice some of the things that we're doing. Make sure that you're using all your prescription drug medication appropriately and not abusing things that are not taking things the way they're not supposed to be taken. Make sure you eat well, exercise, get enough sleep, and use your family and your friends for supports. If you feel like you're using larger amounts of either over-the-counter of either prescribed or over-the-counter medications, talk to a doctor. And most physicians are doing lots of telehealth. UPMC is covering all the copays for telehealth sessions, whether it's with your doctor or behavioral health. Highmark is doing that for some cases, some of their contracts. So take advantage of that to reach out to a professional if you're concerned. And then talk with your healthcare professional. Either get in touch with a counselor, someone at Beaver County Behavioral Health, or a PCP if you feel like your depression, if issues with depression or anxiety or those things are getting severe. Probably everybody is experiencing some of that right now. You know, we're all grieving the lifestyle that we had. So we're going to have some depression, some anxiety, a little bit of anger in there. But if you feel like that's getting out of hand, then talk with someone about that and see if there's something we can do. Having difficulty with depression or anxiety or sleep increases your possibility that you would use alcohol or other drugs a little more. And so that's where that connection is. Let's see. And if you think you have a substance use problem, then certainly talk to someone about that. That makes sense. You have anything to add to that, Kate? Any other suggestions for us earth people, as they say in the rooms, who have a substance use disorder, but could?
Right. This is all really good information. And I'm thinking now, knowing that we're going to have an extension on our stay at home, when you think about habits, and I'm not a statistician or epidemiologist, but I think I've heard that it takes about 6 weeks to kind of start to get to a point where your behavior starts to lay some hard wiring, and your behavior can start to become a habit. That's good news and that's bad news. So let's all challenge each other today. Like all year, let's look ahead at the next almost 6 weeks. And we have some time to really impact great change so that when we come out of this, even if we make one change, and I'll say, you know, when I started just yesterday, I thought, okay, when I get up in the morning, well, first of all, I'm going to be grateful and say thank you that I got up this morning and I have another morning, really. But I'm going to put my workout clothes on. And if I'm going to be on a Zoom meeting, not this one, but where I'm talking, but you know, when I don't have my hand weights beside me, I can do some bicep curls while I'm on a Zoom meeting. I can, you know, take a half an hour break at lunchtime and go for a walk in my neighborhood. If I'm already in my workout clothes,
Yeah.
it inspires me because I'll be honest, I hate to exercise. I really don't like it. And it's hard for me to maintain that as a habit. So, you know, let's just all take a look. We have four more weeks, 5 more weeks where some of our behaviors could become more and more negative and not so healthy, but we could also commit to a change and hold each other accountable so that we could do something really positive in this extended time.
Absolutely. I have seen a couple jokes or memes where it said, I always thought my house wasn't clean because I was too busy. Turned out that's not the case. And I think you could say the same for exercise. Like I always said I couldn't exercise because I didn't have enough time. Well, that's probably not really the reason.
Have it now.
So there, and I'm proud of you, Kate, for putting your workout clothes on. You know, one of the things I have been doing most days, but not every day, is I do try to get dressed in the morning, period.
Yeah. That's a good habit.
That's a good one, right? Because what I found is, and I'll let my little secret out here, when I do my telehouse sessions with clients, it looks kind of like this. And so all you see is this part of me. So I have learned that I can stay in my nightgown and put on a blazer, do my makeup and my hair, and I'm good to go. And I'm comfortable. So, but I don't feel like I do my best work. So I try most days to really get dressed, not just in sweatpants, but actual pants that button. And then I try, but I'm not as good at this, at the end of the day, at the end of the work day, to actually change my clothes. Like signal my brain that, you know, you're not working anymore, because that's one of the difficulties I found is I could just work all the time. You know, I might have a little break here and there, but I'm working. So those are some things. Now, when we talk about people that are increasing their use of alcohol and drug use during this pandemic, there are some people that we need to be particularly cautious about. One is children and our younger people. So maybe they won't have as much accessibility right now, maybe. Although if it's parents, we're bringing more alcohol into the home, that's accessible to them. And same with prescription drugs that we may tuck up in the cabinet for later, and you know, then they have access to that. But children and youth, you know, we have to remember their brains are not developed as much as ours are. So as difficult as this is for us to maneuver, imagine if their brains weren't as great as ours. And that's even tougher. So we need to really watch out for them, and to look at the media that we're exposing and allowing our children and our youth to see. So last night I actually I thought about, but I didn't do it, interestingly enough. I thought about disabling my Facebook temporarily, because I keep getting all this stuff about, you know, it's a hoax, and no, it's serious, and no, it's a hoax, and no, it's serious. It overwhelms me. Plus, I always struggle around Mother's Day, which this weekend's Mother's Day. So happy Mother's Day, Kate, to all you moms out there. Happy Mother's Day. I struggled in the last several years with Mother's Day because that was, of course, the day my mother died. And so as much as I try to be open to allowing my kids to celebrate me, it's hard to see a lot of those messages on Facebook. So I thought about it, but I didn't do it. But we have to be careful of the media and the information that our kids are exposed to. Not just the content, but how much of it. So those are important. We have to be careful about people who have pre-existing trauma or pre-existing issues with mental health, because even though they may be doing really well, this is an added level of stress that could bring a lot of things back up. And we have to be really conscientious about our first responders and our healthcare workers. And when I say our healthcare workers, I include people like myself or people like you, Kate, or every single one of you that's on this list over here of attendees, because we are helping people with health issues, which is dealing with their mental health. There was a study after 9/11, and I think this was really telling. It was a study of over 27,000 police, firefighters, construction workers, and municipal workers who responded to the 9/11 attacks in New York City. And afterwards, 31% of them were diagnosed with post-traumatic stress disorder. So not just the symptoms, but they actually met the criteria for the disorder. 21% with panic disorder, 7% with depression. And then healthcare professionals had increased risks of compassion fatigue. I almost said fashion fatigue. I definitely have that. Compassion fatigue from secondary trauma. So those are things that are all happening right now because we are actually in the midst of the trauma and we're still trying to heal from the trauma at the same time of the pandemic. So those are things to really watch out for. I went to Subway maybe a week ago in Beaver to get my daughter some dinner, and then a police officer came in after me and I said, I want to go ahead and buy your meal. And he said, you don't have to do that. And I said, well, you're out there doing crazy stuff. So, and dealing with crazy people. So the least I can do is buy you a 6-inch, turkey sub.
What a nice thing to do now.
Yeah, well, thank you. I want to move on to talk about some fun things, but is there anything else that you think we need to know about what's going on in the drug and alcohol world?
Just that, Beaver County Behavioral Health is still available, open, and for anybody in need of services, please do not hesitate to call. Our 800 number is 800-318-8138. And, we will do our best to get you connected to the services you need.
That's awesome. Kate, thanks so much. So one of the things I wanted Kate to talk a little bit about because is her cooking. And I have to say too, I'm doing a little more cooking at home. I'm not a good cook, but I was thinking about this story this morning when I first got married. That was many, many, many years ago. And my ex-husband, he was a very good cook. He made a really mean meatloaf. And one day he made the meatloaf and he put it in the fridge and he told me when I get home to put it in the oven at whatever temperature. And so I did. And then when he came home, I didn't take the plastic wrap off of it. He didn't tell me to do that. Like, so I always say I'm pretty smart, but sometimes I do lack a tiny bit of common sense. I've gotten much better over the years with those things, but cooking is something that they really say helps as a coping mechanism, helps with things like depression and anxiety. They call it behavioral activation. So that basically means that you have a goal. You're going to make this dish. You have a beginning, you have a middle, you have an end. You get a reward. You feel good because you accomplished something. So those are all really good things for how we're doing. So tell us about your cooking, Kate.
I have always loved to cook. And I think, from the time I was little, I was like 10 years old, and my mother one night gave me a bag of flour and a package of yeast. And she said, there's a recipe on here for homemade pizza. See what you can do. And like, I felt like a kid in a candy store. Like my mother gave me complete, domain of her kitchen. And I just thought that was the coolest thing. And so from that day forward, I started making pizza for our family. Are we still on? Oh, yeah, here we go.
Yeah, we are.
Yeah, so it's something I do to relieve stress. I really enjoy it. I love the weekends because I like to spend most of the weekend in the kitchen doing meal prepping and getting ready for the week ahead. And I guess in a way it is, especially now, we don't have control of a lot of things in our life. We've had to give a lot of that up. And it's one thing, like you said, I still get a lot of satisfaction out of, because you can control it. You can see your results. You can make modifications. And, I'm kind of a creative, artsy person too. And I think cooking is a lot about art, and I try to help my kids learn recipes. I say, this, you can't fail. Like,
Yeah.
just try, create, have fun with it. So
Mhm.
that's what it's always been kind of my stress reliever. I just have to be careful that I don't eat everything because I like to eat too.
You know, I read a book years ago. It was actually a workbook. It's called The Artist's Way. And one of the things that's always stuck with me about that is about creative things like writing or cooking, anything that we create, that is like, I'm going to say God, it's God for me, but that is like God coming down through you and helping you create something that's never been created before. So even though you and I, Kate, may make the same recipe of pizza dough,
Uh-huh.
it's going to be a little different than yours. And
Uh-huh.
mine's going to be like no one else's that's ever been made, because it's never been made in that moment with with that love and attention. And I always think about that with creative things, and that would apply to the cooking too.
I love that.
It's like a spiritual,
Yeah,
this is me creating. Uh,
yeah.
and that's a really beautiful thing. So some other really good things about cooking, um, the creativity that it gives you. So if you're a cook like you are, you probably just, my mother was like, how much do you put in, Mom? I don't know, this much. Oh,
That's
okay. Well, my mom, speaking because it is Mother's Day, we'll honor her a little bit. She was a fantastic cook. She would bake. She was a baker mostly, and she would bake these new recipes that were fantastic. And after she died, first the mailman came up to me and he said, I was really sorry to hear about your mom. And he said, but do you know how to make such and such? She always made that for me. And I said, no, I don't, because she had all these recipes she designed in her head. She didn't write them down. The lady at the pharmacy was like, do you know how to make, and she put booze and everything. The lady at the pharmacy was like, do you know how to make your mom's tequila upside down cake? I was like, no, I do not. But it definitely can help you with creativity, improves your quality of life, helps you get into the flow. So it helps with like that mindfulness, that you're really attentive to what you're doing in that moment. It's altruistic because you get to share it with others, saves money if you cook at home, and you're helping your brain stay healthy because of all those things that we talked about. So that's good stuff, right?
It is good stuff. It
All
is.
right, I have a couple things here I want to share. So we're going to start to see my screen. Let's see. Okay. Kate, can you see my screen?
I can. Yes.
Okay, good. These things we didn't go through, but here. This reminded me of you, Kate. It says, don't cook too much. I've already eaten. And the grandma here says, okay, I just made a snack. I tried cooking with wine last night. After the 5th glass, I forgot why I was in the kitchen. That goes a little bit toward what we were talking about earlier.
Yes, it does.
Favorites. I'm no cook, but I can follow the directions, which said to let the bird chill in the sink for a few hours. He does look chill.
Yes, he does.
And this is the one that I probably need. It sounds like you might need it too, Kate. You're not hungry, you're bored. Shut the damn door.
I do need that one.
Now tell us a little story. This is a crock pot in the fridge.
Yes.
This is a story, Kate.
I always thought I was a pretty decent communicator, and I've come to learn that just because you talk a lot doesn't mean you're necessarily a good communicator. And my family is wonderful at reminding me sometimes that I could tweak my communication skills a little. So the crock pot in the refrigerator was the result of me sending a text to one of my daughters several years back. I was working, and I said, hey, good morning. The crock pot should be done at 1 o'clock. And when it's done, please put it in the refrigerator. And I get a text a little while later saying, is it okay if the cord goes into the refrigerator? What about the cord? I said, what cord? What are you talking about? So she took the picture and she was serious. I did not tell her to.
I feel for her. I totally feel for her.
It's like your plastic wrap meatloaf.
Absolutely.
So this was the result of, me eliminating a few details and thinking that, she got this unspoken shorthand between us, but she didn't get it. So.
Now here's another communication story with the little butterball.
Yeah, A little butterball. So this is the Mars Venus communication of men and women and grocery lists. And again, thinking that I'm, an extraordinarily gifted communicator, I sent my husband on a shopping trip. This was actually, we were not married yet. We were dating, and he was going out to do some grocery shopping. He said, "Do you need me to pick anything up for you?" So I like to buy those Hillshire Farms, like the lunch meat sandwiches. And I said, "Can you please get me a turkey for lunch?" Thinking he meant, like, he knew that I meant lunch meat. And I said,
Right.
"The little one, not the family."
So this is what you get.
Yeah, so I came home from work, he had stopped by and left all the groceries there, and he put everything away. God love him. And I opened the refrigerator, and there's a little butterball turkey. And where did this come from? And I texted, "Well, you said the little turkey." So yeah, so again, Mars and Venus at the grocery store. I've
Absolutely.
learned
Definitely some discrepancies. We have a couple pictures, Kate, that we wanted to share. This is Kate and her 4 beautiful daughters. Can you imagine how much estrogen is in that house?
And Jill, you've experienced it.
I have experienced that a little bit. They are beautiful. You have a beautiful, beautiful family, Kate. This is a picture of Kate's wedding. Look how little Sam was.
I know.
Gosh.
Powers over all of us now.
Isn't that amazing? Now, this was what year?
This was 2015, July
2015. Okay. Here is Turkey Trot.
Yeah.
Little family. This was just last year.
Yeah, that's a tradition we do every Thanksgiving. It's something that has stuck. Like, even the big kids, make it home for that. We do that first thing in the morning on Thanksgiving. It's lots of fun.
And then you come home and have a little turkey.
Yes, yeah, a little turkey. That's right.
I really love this picture. This is Nate. This is Kate's husband and his son Sam. Now, what was this for?
This was Sam's prom last year, junior prom. So his dad was pinning his boutonniere on, because I have all feminine children. We're a blended family. And I don't know how to put a boutonniere on. So his dad did. And I love that.
Well, and so Sam's graduating now?
Yes. Yeah.
So so what are they doing in Blackhawk for graduation?
Well, we just got word yesterday that they're changing. We originally were told that the kids were going to go in to the auditorium. They would be assigned a time, and each child would proceed in individually and get their diploma. And I think possibly they were going to shake the principal's hand or something.
They were going to elbow.
Yeah, do something like that. Yeah. And then they were going to compile everything on a video and then announce a date when we would watch it. However, we've been told that they may be changing that up a little bit, and more information is forthcoming. So they're working on something. It seems like it's probably going to be virtual. Sam did pick up his cap and gown earlier this week. So,
amazing.
It's an ever-changing climate. But again, I'm as a parent, I am very pleased with the way our district from day one has managed this. Our kids didn't miss a beat. We went to, they left school on Friday. They had an Act 80 day on Monday, and then Tuesday they hit the ground running with flexible instruction from home. And so our leadership in the district, they did a great job, I think, helping us all to adapt to this.
You do feel bad about kids missing their graduation. I know my daughter was supposed to get her driver's license on April 11th. And so last night she came in, she's like, "Another month." I'm like, "You'll get there, Evie." We went to Police Station Pizza last night for dinner, and the guy there said that one of the workers just turned 16, so he wanted to get his permit and he can't. And, all these normal things, but they'll be fine. Now, who's everybody in this picture?
Oh my goodness. Okay, so this is our Brady Bunch picture. So Nate, myself, my daughter Grace, and then Anne, Sam, Ellen, Claire, and then Carson and Kaylee are in the picture as well. They are Grace's absolute best friends slash sisters. They've known each other since 4th grade. And these two girls they show up every day of Grace's life, you know, good, bad, thick, thin. This is what, you know, friendship is. And I just love these two. And so I thought it was fitting to put them in.
To keep them in.
Yeah. So
I love that. So last week I did a virtual session for the school, for the College Square Elementary School here in Beaver, for the teachers, and about stress management and those types of things. And then my kids' teacher is still there, several of them. And so I had to throw this in because just yesterday, Mrs. Murphy emailed and said, look at what I found. So this is my boy, Will, in 1st grade.
Oh.
And he's now 19.
I
have to tell you, when I looked at this picture, it actually made me cry.
Yes.
Because I remember this happy, sweet, adorable kid, and he is still all of those things, but he's got a little bit more of an edge to him now. So I thought, since you were sharing all your family, I'd just share this one little picture of Will.
I love it.
So Kate, I wanted to save this one for the last. Kate had sent this over to me too. Sometimes when things are falling apart, they may actually be falling into place. And I think that is so true. Thought it was very powerful and a really great place for us to kind of end. Is there anything else you want to add today before we close?
I just want to say happy Mother's Day to anybody and everybody who cares for a child, regardless of the prefix that comes before mother, godmother, stepmother, foster mother, adopted mother, anybody who loves a child and mothers a child. Have a blessed weekend, and thank you for all you do, you know, for kids. And Jill, you especially, thank you for nurturing us all through this with your gentle, loving demeanor and your wisdom.
Thank you.
And I miss everybody. I love being a part of this system of care and this family, and, you know, I miss you all. I wish you the best. And thank you so much for your time today. This has been a lot of fun.
Kate, one last thing I saw over here, there was a comment from Nadine. She asked if you were a College Hill MOPS graduate.
I am. Is that?
So this is Nadine Druschel.
Oh my goodness. Hi, Nadine. I miss you too. Those were some happy years of our life. Oh,
so I wanted to make sure you saw that little comment over there.
Thank you.
And I think if anybody, so Jen put up here in the chat, the Beaver County System of Services, everything that you need over there, phone number, website, et cetera, et cetera. And we got some nice comments. Thank you, Lisa. She said, great job, Jill and Kate. Very informative and entertaining.
We know how.
That's what we try. That's our goal. Is let's get some information out, and then let's just laugh a little bit, because what else?
What, thanks to Kim and Jen. Those
Absolutely
are amazing. They keep us moving forward. So
they do. They absolutely do. They're very powerful women. I love that.
Mm-hmm.
That powerful yet very nurturing at the same time.
Yes.
You know, I love that. So at this point, I'm going to bring us all to an end. Hopefully we'll see you guys back next Friday, the 15th, when we are dancing with myself, with Marie Timpano. It's going to be a great one. If you have any suggestions or any comments that you didn't get to put up today, feel free to send them off to Jen, who sent you the registration, and she'll make sure they get to us. All right. Thanks, everybody. Keep safe the world. Take care.
Bye-bye.